I'm Dr. Valerie Montgomery Rice, President and CEO of Morehouse School of Medicine. Today we're at a pivotal moment, a time that demands not only urgency but courage. As Michelle Obama reminds us, history has always shown us that courage can be contagious and hope can take on a life of its own. So this State of the School address is about courage, collaboration, and the future of Morehouse School of Medicine. For 11 years, I've had the privilege of leading this institution, and I have learned that our mission is not confined to our campus. It is actually a national responsibility. The future of health access and opportunity depends on whether mission-driven institutions like ours have the resources and partnerships to scale impact. We were built for this moment, a moment of chaos and change, but also a possibility. I would like to really speak directly to our healthcare peers, faculty, staff, students, supporters, partners, and future learners about where we stand, what we have accomplished, and what challenges we must face, but also what lies ahead. Because the next chapter of Morehouse School of Medicine is not simply about institutional growth, it's about national transformation. Again, we were built for this moment. 50 years ago, we began with a single trailer and 24 students. We had more belief than resources, and yet, look at what we've built. An independent four-year medical school with now 16 degree granting programs, 17 research institutes and centers, and an alumni base who serve where the needs are greatest, not because it's easy, but because it's right. Nearly 60% of our MD graduates who completed residency are practicing right here in the state of Georgia. Most of our alumni serve in primary care, with over half serving in underrepresented communities where access to care remains limited. This is not incremental impact. This is actual structural impact. When I think about the year, we've seen some significant milestones that not only showcase our momentum, but also reaffirm our duty as a national leader in expanding access to care and ensuring every person has what they need, when they need it, and the amount they need to achieve their optimal level of health. One of our most notable achievements was our progress in philanthropy. In April, we completed our $500 million impact campaign, 2 years ahead of schedule, raising $530 million. We did that together. This achievement reflects our collective conviction that health equity is not an afterthought to health care. It's actually the future of health care. The campaign wasn't just about raising money for a school. It was about creating a pathway for students from underrepresented communities to become medical professionals. It's about supporting students who want to become a doctor, a public health leader, or biomedical scientist, but they couldn't afford the education. It's about developing leaders who will help the underserved and in turn transform the entire medical system. Additionally, following our historic gift from Bloomberg Philanthropies Greenwood Initiative in 2024, we have secured more than $50 million in additional philanthropic commitments. Thanks to this initiative, we're expanding support for our students through scholarship that will significantly reduce their debt burden. This gift amplified the need for more gifts to support faculty, researchers, clinicians, and programs like our Center for Maternal Health Equity or the David Satcher Global Health Equity Institute, the Institute for Translational Genomic Medicine, and our $115 million 10-year campaign for the More in Common Alliance in partnership with Common Spirit Health. Our endowment now stands over $260 million, with more to come. However, our work is not done. We aim to become the first historically Black medical school to reach $1 billion endowment within the next 10 to 20 years. Now, this is not about chasing a number. This is actually about ensuring that the next 50 years are protected from federal volatility, political shifts, and unpredictable appropriations. Another major advancement this year was our continued expansion of research. Our 17 centers and research institutes continue to confront diseases and disparities with the highest burden. For example, Morehouse School of Medicine has taken the lead in addressing prostate cancer health equity. Our prostate cancer precision prevention program, known as PCP3, has implemented community-based screening initiatives, collaborated with Grady Health System, all of this to update prostate screening guidelines, and is leading the development of a polygenic risk score to help predict which men are more likely to develop aggressive prostate cancer. MSM also launched the Institute of Translational Genomic Medicine, known as ITGM, the only genomic center at an HBCU and a national hub for genetic research on people of African descent. ITGM will support MSM research with advanced sequencing and bioinformatics aimed to develop new diagnostic and treatment tools through the study of African American genomes. And in a year marked by urgency and innovation, Morehouse School of Medicine advanced its mission to tackle Georgia's maternal health crisis through groundbreaking research, community-centered training, and expanded support services. Our Center for Maternal Health Equity is leading the Maternal Near-Miss Research Project, designed to shed light on life-threatening complications experienced by Black women during pregnancy and childbirth. We also added our Perinatal Patient Navigator program, which serves to train doulas and healthcare navigators to guide Black women through pregnancy and postpartum care, thereby protecting the health of mothers, their babies, and the broader community. And so it is fitting that during our milestone year, we launched one of the most visionary programs in our history, the Division of Graduate Education in Nursing and Intercollaborative Excellence. This program is focused on addressing disparities not just in maternal health, but all chronic diseases. The program will equip nurses with the skills needed to champion health equity and transform care delivery across diverse communities. By preparing family nurse practitioners, nurse midwives, and women's health nurse practitioners, we are intentionally addressing workforce shortages in critical areas of care. This is not, though, simply adding another degree. This is actually filling a gap that is too wide and too deep in our nation's ability to deliver high-quality, culturally competent, humble care. Because the shortage of primary care providers, maternal health specialists, and rural practitioners is not just a workforce gap. It is a gap in care. And we aim to help fill that gap. But in order to do all this, we needed new facilities. So this year, we also proudly opened our new Calvin Smyre Educational Conference Center to support the expansion of all of our programs. Calvin Smyre was the longest serving member in Georgia House history. He helped secure the initial state funding needed for our accreditation and founding, and has advocated for Morehouse School of Medicine for over 40 years. With our new state-of-the-art facility, we can now host conferences and symposium, welcoming the world to our campus. In addition to serving as a conference center, though, the center also provides new classroom space for our first-year medical students to learn and utilize its technology. We've also made progress in transforming communities through national partnership. You've heard over the last couple of years about our collaboration with Common Spirit Health and the More in Common Alliance, and we are expanding our reach nationwide. We now have 5 active sites in Chattanooga, Tennessee, Lexington, Kentucky, Seattle, Washington, Santa Cruz, California, and Bakersfield, California. These sites enable us to bring our model of culturally grounded care and education directly into communities across the country, because workforce development has to be national in order to achieve health justice. And finally, we are so excited that we have strengthened our commitment to Georgia. Morehouse School of Medicine and Phoebe Putney Health System signed a transformative partnership to embed medical education in research in rural Georgia. This agreement establishes a regional Morehouse School of Medicine campus at Phoebe Putney Hospital, new residency programs in critical specialties, and a research hub focused on community health needs and clinical training opportunities for our students and residents. This unique partnership with Phoebe is an innovative way for Morehouse School of Medicine to embed our learners into rural Georgia and invest our resources in ways that benefit the people of Southwest Georgia for generations. We are not simply responding to the future, we are building it. And as we celebrate our 50th anniversary, it is clear that Morehouse School of Medicine is not just transforming health outcomes, but we're also driving economic growth for our city, our state, and our nation. According to the 2024 Trip Up Back Economic Impact Study, Morehouse School of Medicine operations contributed $826 million to the U.S. economy, including $680 million to Georgia and $544 million to Metro Atlanta. Our presence now supports more than 3,900 jobs statewide, and our faculty, staff, and students generated $36 million in state and local tax revenue last year. This study shows that for each dollar the state of Georgia invests in Morehouse School of Medicine, $20 is returned to the state's economy. And when you include our alum, that's $108. This high return on investment highlights that health education is both a moral and economic priority. This report really amplified the impact of our alumni. In 2024, 2,763 practicing graduates contributed $6.3 billion to the U.S. economy, supporting nearly 40,000 jobs nationwide. Within Georgia, their work generated $3 billion in economic activity and created 21,000 jobs. And right here in Metro Atlanta, it generated $1.6 billion and created 10,000 jobs. So Morehouse School of Medicine is really a powerful economic and social engine, producing not just physicians, not just scientists, not just health leaders, but also prosperity, innovation, and opportunity for the communities we serve. However, as we look toward the future, toward the next 50 years, we must be honest about where it stands between where we are now and where we need to go. Our accomplishments this year don't erase the challenges we are facing. And I'll be honest with you, economic headwinds are real. Healthcare costs continue to rise, margins are shrinking, and safety net hospitals are closing. The political climate is shifting with sweeping changes to Medicaid, Medicare, and ACA programs that impact millions. The Big Beautiful Bill eliminated student loan options and reduced the lifetime loan limit, cutting off access to education and adding barriers to opportunities. And of course, we must look at technology. AI, gene therapies, digital platforms are moving faster than sometimes we can keep up with our regulatory and ethical frameworks. Federal terminations of grants alone created a $15 million shortfall for us, impacting maternal health, mental health, genomics, and environmental justice programs. And the NIH restructuring and delayed drawdowns have slowed our research momentum. And of course, I must speak about the DEI line funding, which supports pipeline developments, equity, and community engagements. Many of them have been cut. We still need our new academic research building, a $189 million facility. But in order to move forward with that, we have to be careful with deliberate financial strategies to manage long-term debt. These realities necessitate that we be more strategic, innovative, and collaborative than ever before. The challenges before us, rising health inequities, systemic barriers to care, and the evolving needs of our communities are significant, but so is our resolve. We must prepare for what comes next, not simply by educating more healthcare professionals, but by changing the systems that shape outcomes. We must think beyond traditional medical education and embrace technology, policy, and innovation as core tools for advancing healthcare. We must reprioritize our fundraising areas, always focusing on scholarship, but thinking about the facilities required for the learning environment and focusing on those diseases that disproportionately impact the communities that we serve. We have done what we always do. We run toward the problem, but we cannot do it in the old way. In 2022, we introduced a strategic plan, the New Day, to guide us through 2026. This plan remains active and relevant, and we continue to focus our efforts on our 4 priority areas: translating discovery and innovation into health equity, building bridges between healthcare and health, preparing future health learners and leaders, and serving as a catalyst for community-empowered health equity. But we are modernizing as we advance and transform. That's why we've implemented a new enterprise resource planning platform, Workday. It's going to replace our fragmented systems with a single, unified operating environment. Workday will provide us with a single source for managing our people, finances, contracts, and procurement. We'll automate what is currently manual and eliminate duplicate data that slows us down. Now, these changes are going to be felt across every stakeholder: faculty, staff, vendors, partners, and leadership. But we will all benefit from streamlined processes, greater transparency, and stronger forecasting. Our students, our mission will benefit because every operational efficiency becomes a dollar that can be reinvested into education, research, and community impact. We owe our students and our mission not just resilience, but endurance. And endurance requires investment. Scholarship matters. So as we expand our nursing programs, our MPH, and our physician assistance program, we aim to provide 50% tuition support based on their need and offer full merit-based scholarships to select students. We must build on our campaign and fundraising successes while expanding opportunities that directly support our students. If America wants to ensure access that leads to optimal health for all, it needs institutions like ours, because we are not simply producing healthcare professionals. We're training healthcare leaders who are culturally humble, community-focused, and mission-driven. We're not only generating research, we are creating solutions for the populations who experience the greatest burden of disease: birthing outcomes, chronic illnesses, cancer, and cardiovascular disease, the conditions that continue to expose cracks in our system. And we are not just developing talent. We're building the infrastructure for a more just healthcare system for all. To achieve that, health equity is the starting point. It is the foundation upon which this institution was built. We fundamentally believe that when we provide people with what they need, when they need it, and the amount they need, every person will be able to achieve their optimal level of health. As we approach the holiday season, when the nation pauses and we sit with our loved ones to reflect on what matters, I want to share what sits at the core of my heart. I am grateful. I am grateful to every faculty member who pours into our learners. I am grateful to every staff member who leaves no detail unattended. I am grateful to every student who chose this mission and not just a degree. And I am grateful for every partner who stands with us, not performatively, but sacrificially. I am grateful for every donor who invests, not to just check a box, but to change a system. And I am grateful to lead this institution in this moment because I know what is possible. The cornerstone of our success is the depth of our partnerships, from Grady Hospital to Emory University School of Medicine and its teaching hospitals, to Children's Hospital of Atlanta, the VA healthcare system, and all of the federally qualified health centers, to St. Francis Emory healthcare system and Piedmont Columbus Regional Midtown Campus, to our primary care providers and the small practices who take on our students, to our national partners with Common Spirit Health, Atrium Health, Advocate Health, and Phoebe Putney Health System. These organizations allow our future physicians to grow, train, and learn. Together, we will build the future workforce this country needs. We will secure the resources this institution deserves, and we will drive research that shifts outcomes, not someday, but to now. And we will make health access and care not a slogan, but a lived reality. The world needs more providers, researchers, and public health advocates who mirror the communities they serve. People who understand that health is shaped not only by science, but by access, environment, and opportunity. At Morehouse School of Medicine, we are not only improving health outcomes, we are strengthening economies, empowering communities, and ensuring that every person has what they need, when they need it, and the amount they need to reach their optimal level of health. Thank you.